As of June of 2017, when this patient started her treatment, there were 3 available tyrosine kinase inhibitors, erlotinib, gefitinib, and a little bit more recently, afatinib. And this patient was appropriately started on a TKI, specifically afatinib, part of the second-generation wave of TKIs directly targeting EGFR mutation. Afatinib is an intelligently designed agent. Has some advantages over the first-generation TKIs, such as erlotinib, gefitinib. It's an irreversible inhibitor of EGFR. Has some activity against T790 as well as HER2. In an older randomized phase 3 trial that included folks with EGFR mutations, but also non-mutated patients with some sustained benefit from first-generation TKIs, afatinib clearly outperformed placebo. The progression-free survival was nearly triple in the afatinib group. We have seen data now comparing afatinib to chemotherapy, to pemetrexed and platinum, the LUX-Lung-3 trial, and to cisplatin and gemcitabine in the LUX-Lung-6 trial, the latter performed exclusively in China, both of which showed clear-cut, statistically significant, clinically meaningful improvements in response rate and progression-free survival. So it's important to realize that this effect has been seen globally. LUX-Lung-7 was a very interesting trial. It directly compared afatinib to first-generation TKIs, in this case to gefitinib, and showed a clear-cut improvement in response rate, time to treatment failure, and progression-free survival. So the superiority of second-generation TKI was established by this trial. It did not, however, show an overall survival advantage. There was a numerical benefit, about 3 months, roughly 27 versus 24 months, with a hazard ratio of 0.86, but the confidence intervals did overlap unity. If you look specifically at exon 19 group, which always, that population always seems to do a little bit better, about a 4-month difference, 30 plus months versus 26 plus months, slightly better hazard ratio of 0.83. Afatinib, however, at least in my practice, has been used preferentially in patients with exon 19 mutations. Go back to both LUX-Lung-3, which compared this agent to platinum and pemetrexed, and LUX-Lung-6, which compared this agent to gemcitabine and platinum, and look specifically at the exon 19 population, we see a consistent 10 to 12-month improvement in overall survival, specifically in individuals who had exon 19 mutations.